Good morning to one and all. Today we will be seeing a class on history and clinical examination on swelling. There are a number of swellings which present at the OPD department of an oral medicine department. The definition of a swelling is a lump or any enlargement in any part of the body or an organ or any part of the organ. The swelling may be known as an abscess, a cyst, a hematoma, a neoplasm, hamartoma, or choristomas. So what is the definition of an abscess? An abscess is a localized pathologic cavity which contains pus, dead and dying polymorphs, necrotic tissue, and covered with pyogenic membrane, which is a fibrin barrier. There are many abscesses which present at the OPD, like periapical abscess, periodontal abscess, dentoalveolar abscess, etc. Coming to a cyst. A cyst is a pathologic cavity which contains fluid or semi-solid tissue, and it is always lined by an epithelium. A hematoma contains blood, so it is an extravasation of blood from traumatic injury or damage due to any pathologic process. Neoplasm. A neoplasm is a tumor and it is an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of normal growth. And it grows in the same manner even after cessation of the stimuli which evoked it. Hamartoma. Hamartoma contains irregular mass of tissue from the same site, whereas choristoma contains tissue which is not native to that particular site. Both of these are actually developmental malformations of tissues, and it can occur in the growth period of an individual. Coming to cellulitis. A cellulitis is an acute inflammatory diffused spreading enlargement which contains infected material like any tissue fluid or pus. Traumatic swelling occurs immediately after a trauma. Coming to the diagnostic methods to diagnose a swelling, it can involve history taking and clinical examination. In history taking, there are a number of questions which has to be noted down and asked to the patient. It starts with when exactly has the swelling started? What is the duration of swelling? Whether the swelling is painful or it is not? Does it have any aggravating factors and relieving factors? Does it increase in size or has been stable for a long period? Whether the swelling is recurrent or newly occurring, whether the swelling has any discharge like pus or blood or any watery discharge, whether the swelling has secondary changes, or whether a similar swelling has occurred anywhere in the body, like if there is multiple swellings in the body, or whether the swelling has already been treated and it is a second time that is recurring. All these parts of history are very important before we proceed with the clinical examination. Coming to the clinical examination, it is divided into two parts of inspection and palpation. Under inspection, the number of swellings have to be noted down, whether the swelling is single or multiple. Next is the position, whether it is localized or a diffuse swelling. The site of the swelling, whether it is present in which part of the face, like the mandible or maxilla or zygoma, anterior part of mandible, etc. Region of the site, that is the more anatomical landmarks of that particular site, like the supraorbital region, the infraorbital region, the commissures of the lip, the tragus region, preauricular region, etc. This has to be more specific and it helps us in identifying the borders of the swelling. Coming to the shape, swellings can be circular, ovoid, irregular, or elliptical, and they can have different colors like black, yellow, or normal skin color itself. Coming to the margins, it can be well-defined or ill-defined, and the smoothness can be, the surface of the swelling can be smooth, or sometimes it can be lobulated. Extension is, it has a superior extension, an inferior extension, an anterior extension, and a posterior extension. The skin over the swelling can be normal, or sometimes it can be shiny and stretched. Sometimes the swelling can also be accompanied by secondary changes like formation of ulcers, any fistula, or fungal infections over the swelling. Coming to clinical examination, again, before we proceed, we need to look in for any other discharge which is present or any pigmentations like patchy, spotted pigmentations over the surface of the swelling, vascular changes, or any other changes which needs importance. Going to the palpation part, palpation is nothing but the confirmation of the inspectory findings. First, we need to check for the temperature of the swelling, whether it is normal or warm. The tenderness of the swelling, that is, when we touch it, does the patient elicit any pain? Coming to the consistency, it can be a soft swelling, a hard or a firm swelling. The surface can be smooth or lobulated, or it can be irregular. The edges can be well-defined or ill-defined. The surrounding structures can be normal or it can be infiltrated, and even the surrounding structures can be tender. The pressure effect has to be checked, whether it yields in pressure or it does not yield in pressure. Whether the skin over the swelling is pinchable or it is stretched. Whether there is movement below the skin or it is attached to the bone which is lying below the swelling. When we talk about attachment, it can be sessile or it can be pedunculated. And the swelling can have a fluctuation which can be positive or fluctuation negative. So this is also a very important clinical test which has to be tested with the gloved hands. Compressibility, whether the swelling can be compressed or it cannot be compressed, whether it is reducible or it is not reducible, and whether there is any discharge when we apply pressure to that particular swelling. And also transillumination has to be checked. For transillumination, we can use a small torch which can be kept on one side of the swelling and check whether the light or the shadow of the light is appearing on the other side of the swelling. If there is cystic content and watery content inside the swelling, it is most probable that transillumination will be present. Whether if it is having some bony filling inside or it contains any dense kind of material inside, the transillumination will be negative, as the light cannot travel through any dense material. Also, the teeth associated with the swelling have to be completely noted down, whether they are regular teeth, normal in occurrence, or they appear abnormal with widening of PDL or loss of alveolar bone surrounding it, etc., have to be noted down. Coming to lymph node examination, all the major lymph nodes of the head and neck region, like the submental, the submandibular, the sublingual, upper deep cervical, lower deep cervical, have to be completely checked before we go in for the diagnosis. And under diagnosis, a swelling can be of many types, mainly congenital, developmental, traumatic, a benign neoplastic swelling, a malignant swelling, or it can even be inflammatory swellings, which very commonly occur in our OPD. Thank you.